A local nursing home under increased scrutiny this morning amid the COVID-19 pandemic. The issue is whether Hurlbut Nursing is being truthful about who's dying from the disease and just how many people. Now there are calls for a formal investigation. Maureen McGuire reports.
Like all senior care facilities, the Hurlbut Nursing Home in Brighton is now required to report COVID-19 deaths to the state. Facilities that have more than 5 deaths must be named in the report. In the most recent data from the State Health Department, 22 nursing home residents of Monroe County have died of COVID-19, including 8 residents of St. John's in Rochester. The report does not name Hurlbut, even though an investigation by the local Democrat and Chronicle shows at least 7 of its residents have died of COVID-19. Monroe County Health Commissioner Dr. Michael Mendoza says state health officials should investigate.
We are generally never informed of them by the nursing homes. That's never been the practice anywhere here in the county. And if we happen to know about them, it's either incidentally because we're reading the obituaries in the paper, or we hear about it through other means. And sometimes it's through journalism from you and your colleagues that brings us to our attention. But we've been following this. We've done contact tracing. We have what we believe is an underestimate, but the question really is it off by a little or off by a lot? And that's been the reason why I've always been hesitant to release information that I don't believe is accurate. And so that's the reason why I want us to get collectively behind the State Department of Health to dig into what is accurate and to offer that transparency to our community.
At a time when families are not allowed to visit loved ones and facilities scramble to protect residents and staff, the demand for transparency is growing, especially from nursing homes that are severely hit by COVID-19. Maureen McGuire, News 8.
Hurlbut operates 13 facilities across 3 upstate counties and confirmed there have been losses due to COVID-19 at all 3 of the facilities. It did not say how many people, but acknowledged even one loss is too many. In a statement, owner Bob Hurlbut said, quote, "We report only COVID-19 positive fatalities that occur in our facilities. Any death that occurs at a hospital is not reported by our facilities and is not required to be reported by our facilities under the current mandate." Hurlbut said to the company's knowledge, all of the information it has submitted to the state has been accurate.